Now, many people don't realize that there is a gut-eye connection. People have heard perhaps of leaky gut syndrome, inflammation in the gut microbiome, but there's really interesting emerging research being done on gut health, and it's linked to macular degeneration. So there's some early work showing that certain types of gut dysbiosis can increase the risk of vision loss from a type of macular degeneration that's called wet macular degeneration. I like to call it leaky eye syndrome, so similar to leaky gut, leaky eye syndrome. Yeah. So anyway, my book addresses what I think are the 7 key strategies to prevent macular degeneration. So nutrition, lifestyle, gut health, foods to avoid, supplements, stressors, and there's a couple of other things in there as well. So there was a really interesting study done out of Massachusetts Eye and Ear, University of Illinois, and then Manhattan Eye and Ear Infirmary a couple of years back that looked at people who had diets high in the SAD diet, meaning processed foods, refined carbohydrates, unhealthy omega-6 fats, or high levels of unhealthy omega-6 fats. And they found that those people had a higher risk of vision loss from macular degeneration. So those are the main foods to avoid. Really just for prevention strategies. And unfortunately, many of those foods, people, our society, our culture is really kind of geared towards that. So really, it's kind of difficult to kind of steer people away from those types of foods.
Well, speaking of that gut-eye connection, I'm really curious about this because I do a lot of gut health, of course. In med school, we learned all about Crohn's disease being associated with iritis or uveitis, right? So, I mean, when you have someone come in with an eye disorder, I mean, are you also in most cases treating the gut as well?
Yeah, so I'm glad you brought up that connection between inflammatory bowel disease and eye inflammation, because uveitis, which is kind of the larger term for eye inflammation, is very commonly associated with autoimmune conditions. So not just Crohn's, but other things like lupus and many other inflammatory conditions. So my approach is basically in the acute phase, patients may require steroids, really just to keep the eye quiet. So absolutely, I do use traditional methods like topical steroids, sometimes even oral steroids. But I also put my patients on a dietary protocol to try to remove pro-inflammatory foods and try to replace them with anti-inflammatory foods. And then I also sometimes I definitely use probiotics, prebiotics to promote gut health. And it's, when patients are on this approach, what they need to realize is that the change is not going to happen overnight. It usually takes a few months really for everything to calm down, to settle down, for their eye inflammation to improve, but also their gut issues to improve. And I've really had really remarkable successes in my patients who've been able to be compliant with not just the eye protocols with their steroids, but also their dietary protocols.
Well, that's great. I mean, I'm absolutely supportive of the functional medicine approach there. So that's great. Speaking of foods again, my dad mentioned some foods that should be avoided. What is your take on gluten and its connection to the eye? I'm curious.
So if someone has a predisposition to autoimmune disease, whether that be, like we talked about, inflammatory gut bowel disease, I also deal with a lot of patients with multiple sclerosis, autoimmune thyroid disease when the eye gets involved, like, for example, Graves' disease or Hashimoto's, also myasthenia gravis. So for all of those types of patients with a predisposition to autoimmune disease, I tell them, cut out gluten, not just gluten, but gluten and dairy. And patients realize, once they've removed it, that their inflammation settles down, but also if they happen to have a little bit of it by accident or by mistake, they immediately flare up. And they know that their body is reacting to that particular compound in the food. So they themselves know that it's a no-no. It's best to avoid that.
Yeah, that's good to hear from coming from you, because I think gluten, it's gotten not a bad rap per se, but a lot of people will say, oh no, that's just a fad. It's just a gluten-free thing. It doesn't really mean much. But no, I'm telling you, and I think you've seen as well, I mean, it makes a huge difference in those that have an autoimmune disease, giving it up for
Absolutely.
that matter. So
yeah. And even though patients may have the autoimmune disease, other things start to clear up as well. For example, if they've had skin issues, they start to clear up. I mean, it's just for, I think, overall health. If one is prone to autoimmune disease, it's best to avoid
exactly
gluten and dairy.